Hi friends, welcome to classes by Lab Doctor. In today's class, let us discuss in brief about the dosage of this warfarin and how do we monitor this warfarin, and also what are the drug interactions and what are the conditions or precautions which we have to take when we have a patient who is taking a warfarin, or as a healthcare provider, when you put a patient on warfarin, what are the things which you should be aware of. So you all know that warfarin is a very commonly used anticoagulant. It prevents the coagulation of blood. It makes the blood thin. It prevents development of clots. And why we don't want the clots? Because these clots can cause complete cutoff of the blood supply and can cause end organ damage. Like you have a clot in your limbs, in the varicose vein, deep veins. It can cause a gangrene, or it can just move away from that place and enter into your pulmonary circulation, causing pulmonary embolism and death. If you have a patient who is having atrial fibrillation, and this atrial fibrillation can dislodge a clot from the heart and send it to a vessel in the brain. So that clot can go and block the blood supply to the brain, causing stroke, paralysis, TIA, transient ischemic attack. So in such patients who are having the risk of developing clots, or who have already developed a clot and we do not want them to undergo complications, we put such patients on this warfarin. So warfarin is used in atrial fibrillation, pulmonary embolism, myocardial infarction, congestive cardiac failure, thromboembolic stroke, deep vein thrombosis, etc. This warfarin needs to be monitored, and the dose also has to be adjusted as per patient's requirement, and it varies from individual to individual. You all know that this warfarin, it acts by blocking your vitamin K. So it is a vitamin K antagonist. And why and when it blocks this vitamin K, what happens? The vitamin K dependent factors, your 2, 7, 9, 10, all these are not activated, and hence the clot is not formed. We have learnt about this PT-INR in detail in our previous classes. It is used to monitor this warfarin. Okay, so whenever you are giving warfarin to any patient, we will have to monitor their PT-INR. The patients will require frequent blood test, specifically the INR. PT varies from lab to lab, but INR becomes very important. We require it to monitor how quickly their blood is clotting, and to see that dose is in the correct therapeutic range. Okay, so this warfarin, we usually tell the patients they are supposed to take it only once in a day, and preferably at the same time, because we want the level of this warfarin in your blood to be in the therapeutic range. So only once in a day and at the same time preferably. How many days or how many months we have to take this warfarin, that depends on the patient's condition. Okay, it might vary from individual to individual depending upon the severity of his condition, what has caused him this condition, etc. Sometimes patients, we put the patients only for few months, sometimes it is told for a lifetime. So it depends and varies from patient to patient. Warfarin comes in a tablet form. It's not an injection or anything. It comes in a tablet form. I have told you that it has to be taken only once a day. You can take it with your food or without food. And I've told you that it is always better to take around the same time of the day as advised by your physician. And if you are taking, or if you by mistake you have taken more than one dose, more than the prescribed dose, then please consult your doctor immediately. Warfarin usually started on a low dose, and gradually we increase or decrease the dose based on the results of your blood test. So especially your PT or INR tests are done before starting this. Okay, so because we do not want any kind of a bleeding, especially in the first 3 months of the treatment. And warfarin, you should store it at room temperature, you away from direct sunlight, moisture, extreme cold or extreme heat. Okay, so this I have told you the adult dosage. This is the in venous thrombus. So the initial dosage and the maintenance dosage. Yes, the initial dosage, whenever there is a thrombus, we will have to give the patient 2 mg to 5 mg IV or oral for 2 days. Later on, when we put them on the maintenance dose, we give them around 2 mg to 10 mg once daily. Even same thing with your stroke or your post MI, etc. Initially, we will have to give them for 2 days of 2 mg or 5 mg, but later we put them on a once a day routine. Side effects of this warfarin: patients can have bleeding gums, bleeding nose, headache, severe headache. If he has intracranial bleed, he might have dizziness, he might have difficulty breathing, he might have unusual bruising, he can have bleeding from his cut wounds or injection sites. Sometimes females complain about heavy menstrual period, etc., because of this warfarin. Sometimes there might be blood in the urine if there is a genitourinary bleed. If there can be a gastrointestinal bleed, patient can have black stool, tarry stools. He might have this coffee ground vomiting, or there can be mild rash because of this allergy. Sometimes there can be hair loss, sudden change in speech or vision if there is an intracranial bleed, or bleeding inside the eye, or the sometimes patients have this purple toe syndrome because of this warfarin. Also note, warfarin interacts with many of the drugs. So if you are taking warfarin, you should be aware that there are many other medicines which can interact with this warfarin, and they can change your action of this warfarin or affects its therapeutic range and also its function. Okay, so like you have anticoagulants. If you are taking some other anticoagulant, apixaban, etc., that can interact with your warfarin. Antiplatelet drugs, aspirin. Okay, certain medicines which we put for heart patients, amidaron, pesiron, etc., they can interact with warfarin. Cholesterol lowering agents, bezafibrate, cholestyramine, etc., they can interact with warfarin. Your antibiotics like erythromycin, norfloxacin, that can interfere with this warfarin. Your acetaminophen, that can also interfere with your warfarin. Antifungal medications like fluconazole, miconazole, ibuprofen, naproxen, they can all interact with this warfarin. So you should discuss with your doctor on also on the medicines, other medicines what you are taking, because these medicines can interact with warfarin. It can also interact with phenytoin, sucralfate, carbimazepine, rifampin, phenobarbital, etc. Many times patients are on various supplements. They can also interact with your warfarin. Your vitamin E, patients sometimes just pop in vitamin E, coenzyme Q10 as a supplement. So these can also affect your vitamin K level. So this also has to be discussed with your doctor. Sometimes warfarin interacts with food also, like your cranberry juice, green tea, your garlic, alcohol can alter your levels of warfarin because it interferes with its clearance, so metabolism. That is why when the patient is on warfarin, you have to be very careful when you are on such food items. It is important to note that vitamin K levels in the body can promote clotting, and they can reduce the action of this warfarin. So consistent intake of vitamin K rich food, like you are having a lot of green leafy vegetables, etc. Sometimes they can alter, or they can cause fluctuation in your warfarin levels, and it can also affect your warfarin effectiveness. So this has to be discussed with your doctor, but know that there is interaction with food also for warfarin. Interaction with the disease, patients who are diabetic. In diabetic patient, therapy with warfarin should be administered with caution, especially with severe diabetes, because one is they have an increased risk of bleeding, and diabetes, it increases the risk for conditions like atrial fibrillation, etc. So they will require anticoagulants. But some diabetic medications, they will increase the risk of hypoglycemia when combined with warfarin. So that can also have a bad effect. So you should be cautious when you are putting warfarin with this on this patients who are having diseases like diabetes. Liver disease, yes, because it can affect its drug clearance, warfarin clearance, so can affect its level. Renal dysfunction also, chronic kidney disease patients, etc. They have decreased plasma protein binding, and they might again require dose adjustment. Protein C deficiency, patient already has protein C deficiency, and initiation of this warfarin may cause thrombotic occlusions, and that might cause serious side effects. So those were few of the interactions with medicines, with food, with supplements, and also in certain disease conditions. You should be very cautious, or you should give this warfarin with caution when you have a patient who is allergic to warfarin, or you are going for a surgery or a dental treatment. There might be uncontrolled bleeding, so you should get your PT-INR test, etc., and you have to discuss with your doctor regarding this taking of this warfarin during the whole process, and accordingly adjust your dosage. Patients who are on high blood pressure or very high blood pressure patients, they are also at a risk of bleeding when they are on warfarin. So you also have to be cautious in such people. Alcohol, I have already told you, it interacts with this warfarin, hence you should be careful when you are taking warfarin and also consuming alcohol. If you are definitely having a bleeding disorder and we give you a warfarin, yes, there is increased chance of bleeding, so you have to be very cautious. In head trauma patients, warfarin is contraindicated. The patient already has a previous history of intracranial hemorrhage or recent history of an extracranial bleed. And pregnancy and breastfeeding, we do not recommend warfarin because it increases the risk of congenital disabilities, and warfarin passes into the breast milk in small amounts, so it's contraindicated during pregnancy and breastfeeding. Kidney disease patients, I've already told you. GIT bleeding, if the patient is having an active ulcer, so there might be increased risk of bleed, so we contraindicate it. In old patient, debilitated patients, they are usually very sensitive to this warfarin. They have low body weight, they have reduced liver kidney functions, they take low vitamin K also. So for in them we have to be little cautious when we put them on warfarin. If you are on warfarin, you should be careful while you're brushing or shaving, etc., because it might cause bleeding. So these were few conditions wherein you need to be either cautious, or few conditions where we contraindicate this warfarin. These were few of the drug interactions, contraindications, precautions, and dosage of this warfarin. Thank you so much for watching the video. Please like, share, and subscribe the channel. Thank you.